Good evening, everyone, and welcome to the Physician Forum for Otolaryngologists with Dr. Bert Brown, an Ohio-based ENT specialist. I'm Emily Morta from Modernizing Medicine, and thank you for joining us tonight. We'll start tonight's presentation with an overview of Dr. Brown's experience with EMA Otolaryngology, and we'll follow with a question and answer session. Please write in your questions at any time during the webinar in the questions section of GoToWebinar. We will do our best to answer all questions, but if for some reason we cannot get to them all, we will follow up with answers after the broadcast. It is my pleasure to introduce Dr. Bert Brown.
Thank you for having me. I actually am located in Cleveland, and I'm a solo practitioner. At one point, I ran a group of 10 doctors, but as people retired and they moved on to other things, we got smaller, and eventually our group was actually bought by one of the big institutions in Cleveland, the Cleveland Clinic. And I elected to stay on my own just because I thought there were just better efficiencies I could do on my own. And as most of us know who are still in private practice, you have better accessibility for your patients. So that's how I ended up on my own. And I've been with Modernizing Medicine for a year now. I got out on my own about, I think it's maybe, I lose track now, maybe 4 years ago. And at that point, I had a very outdated EMR, which was old time. And actually, we had the server in our office, which broke down many times and was kind of horrendous. From there, I went into a more contemporary EMR, but there were still things I didn't like. And so then from there, I searched out what I thought was a better EMR. And in fact, it has found to be true, and that being what EMA through Modernizing Medicine. So that's pretty much my story. My previous EMR experience, as I said, I earlier had this system, which was the beginning of EMR before it was even required, and essentially it was terrible. I would say if you have a system that requires the server to be in your office, unless you have a savvy, dedicated computer person, that you just shouldn't do that. And I don't think there's many that do that. And so I really was leaning towards a cloud-based system after that. As far as searching, I was actually very lucky. And based on my previous experience, I already researched a lot of EMRs, and I was fortunate enough to have someone who was a part-time administrator at an ophthalmology practice who introduced me to EMA. And actually, EMA had just started with ENT at that time. And when I saw how the system worked, though, it was kind of a no-brainer for me because I had already gone through a bunch of EMRs, but EMA was just clearly far better. As far as the implementation, I found that to be very easy. Given the fact it was cloud-based, that was really easy. So it wasn't like we needed all this specialty things that we had to do to get it up and going, and the training was easy for the whole staff to sign on to and get the training. Implementation with EMA was very easy. And in regard to training and support, we got a certain amount of hours from EMA, which actually I found to provide all you needed. In our previous experience with implementation, they didn't give you nearly enough information. So when they left, it was very difficult. But with EMA, there was enough time available, hours of work. You had your sandbox you could work in. And it just worked quite well. Training, from my standpoint, was just pretty easy because I had done a lot of EMR. So even though I don't even remember what allocated time I have, it was supposed to be something like 8 hours or 10 hours. I just required maybe 1 or 2 sessions, and I just wanted to start using it, which I did. And a few things that I just didn't figure out, but I find it's better to figure things out as you're working. And then since EMA is pretty easy to use and it's easy for the staff to use, in regards to staff roles, I think it really depends on the way your practice operates. For me, as a single practitioner trying to control overhead, I have 2 front desk people, and I actually have them do all the entering and even as far as medications, history, and things like that. And then they even put a little bit of the history of present illness, and then I embellish that or add to that as I see the patient. So that works very well for me. So when I'm ready to go into a room, I already have the previous medical history in order and an idea of why they're there. And so it works pretty well. And I think every practice will have a different staff setup. I do find that working with Emma helped my practice productivity significantly because it's a very efficient system and it's very intuitive when you talk about the workflow. One thing in particular for those who'll see Emma, you know, all the new EMRs have templates, but one thing that Emma I found to be unique is you don't really have to go through the physical exam template in particular, but actually you can put the diagnosis in, and then right from there, you can just go right to the relevant physical findings for that diagnosis. You have to pick your exam template before that, but then you don't have to go through each piece of the template. And then what I've found is it just works really well to put the diagnosis, highlight the important findings, and the rest of the normals are automatically in. I might do it differently than most people in regard to how I do the notes because I don't really use the iPad. In earlier conferences I attended, even medical legal conferences in regard to EMR, they emphasize the importance of having some personalization in your note, especially when you're using a lot of templates. And the templates for EMA are excellent, and they actually can be customized to whatever you want, and they can be changed too. But I do some free texting in the relevant findings, not only the relevant physical finding often, but often in the counseling. And there's a template where you click on counseling, but there's always a place in EMA to customize it, and there's where I free text what I told the patient. So if that note's ever looked at, people can see that I have templates, but it's also clear that I personalize it and I've spoken to the patient, and I'm not just rotely putting things in. For those of us who've gone to conferences, they're really down on the whole copy and paste mechanism. And in fact, they kind of don't want you to use it in EMRs as well. Another thing I have found to be really good about Emma is they're really up to date in what's going on. So when ICD-9 was going to ICD-10, I wasn't even worried, to be honest with you. I know they had some webinars on it. I didn't even go to them. I just figured that Emma, because of the way it works and how the diagnoses you pick them, I knew that they would have the ICD-10 diagnosis ready to go. And in fact, that was the case. I think there were some minor changes I had to do to how I operated the system because of the new ICD-10, where you have to identify the sides and things like that. But that was very easy to do at the end of your diagnosis. And in regard to evolution of the product, Emma is always evolving. I know that they have many people who are always giving suggestions, and I have to see on a fairly regular basis it's always being upgraded and improved based on people's recommendations. So when I look at the whole picture of all the things I talked about, what I really like about the EMA Otolaryngology, I think it's very intuitive. It really follows what we used to do when we had to do office notes. And in fact, the way I use it is I look at briefly at my computer before I go in, summarize in my mind what's going on, and I go in without a computer into the exam room and do it kind of like we did in the old days, where I get all the facts from the patient, identify what I want to put on, and then I go out to my computer after and just put in the important features, and it only takes a few minutes. So what Emma has helped me to do is get back to the patient-doctor interaction, and it actually works almost as quick as doing notes. So actually my patient productivity went up significantly. I was able to add at least a patient an hour just by using Emma over the other EMR.
That's really great. Thank you so much for sharing, Dr. Brown. If it's okay with you, we'll now transition to the question and answer session of tonight's webcast.
That sounds fine with me.
Great. So let's see. Our first question that we have here is actually a two-part question. So how does EMA cater to your ENT workflow, and does EMA come with ENT information built in?
Yes. The good thing is, since this was really created, at least what I've worked with is ENT, was created by an ENT doctor. There's a total understanding of the diagnosis, the way an ENT doctor works. As you know, history is always important, but it's not always so relevant for what we need to identify in our subspecialty. So the history is there, but you can pinpoint down right to the way you would do your exam before the days of EMR. And all the diagnoses are pretty easy to find. It's easy to click on them, and actually if for those who want to use templates, the relevant things that you want to identify on the exam are there and ready to go. And you can click on those or add to it as I do. And then even in the plans are very ENT specific. So I have found the plans to be very easy to do. And the plan that I normally identify for any sort of ENT problem is in the system already, so I can just click on it. And even things like, say, if you do a myringotomy or a myringotomy and tube in the office, that's already in there when you're talking about serous otitis media. Click on that in the plan, and actually your opera report already has a template identified. And I have found that the templates have everything that I have used in the past. So I have not had to add to them. I have not had to do anything special, and it's made it somewhat seamless. So I think they're very specific in regard to ENT.
Great, great. And just to clarify to the audience, EMA isn't actually template-based, but yes, you can create your own templates and you can customize it like you do, Dr. Brown, for use. So
that's good that you're identifying that. As a non-computer guy, I said template-based. Probably that's I apologize for that. Yeah.
No problem. People tend to use that word, but we always just like to clarify that.
Very good.
So this one talks a bit about your previous experience. So you did mention the previous systems that you used, but this question is asking what specific features in EMA did you find more beneficial and that you liked better than your other EMR systems?
Well, as I noted, EMA is cloud-based, which I think is essential in this day and age. So we don't have to have that whole VPN and getting your computer set up for it. You also have access to EMA everywhere you want to go. I thought it was much more intuitive in regard to ENT. As far as identifying diagnosis, you can go right to the diagnosis, and then from there, you can go ahead and add to your physical exam or your history or whatever you want, because as most of us know, you have a fairly good idea in ENT of what's going on pretty early on. So you can actually focus on that right away. And then given the way I use it, of course, I'm just talking to the patient, but it helps me to complete a note very quickly after I've actually done almost like old-time medicine where I don't even bring the computer in the room. And you could not do that with any of the other systems. You could do it, but the amount of work to get to all the things you want to do, because they're not as intuitive, would probably add 10 or 15 minutes per visit, and that actually would not work very well.
So you may have already covered this, but it's regarding the implementation. How long did it take to get EMA implemented? Because I know that that's always seems to be a fear for people, especially if they're coming from paper, that that this may lower the practice productivity for quite some time while everything gets set up. How was that process for you?
Well, I will say in our office, since we had a reasonable EMR before we went to EMA, so they were somewhat well-versed. I'm trying to remember. I think it took about 3 weeks, the process. As I say, for me, it took about 2 hours, and I was ready to go, but my staff was a little bit more leery. But 3 weeks worth of their training sessions, and we were up and running.
Great, good to hear. The next question, this is regarding the coding. So you had mentioned the ICD-10 coding and not being too worried about it. This question asks, how is the coding accurate? And do you really have to double check and come up with the codes on your own, or does EMA take care of that for you?
EMA is very good at coding. As I say, the diagnoses, when you went from ICD-9 to 10, the diagnoses were automatically changed to proper numbers of coding. I can find most of the codes in there. And one thing that also is good with EMA in regard to their final billing analysis, I always check that at the end, which I hadn't in the past. For number one, reminds me if there's something I'm missing. And number two, it actually gives you suggestions of things that should be included to be the proper code that you're searching for. And that often points things out to me that I might have neglected to do or should do. I've really had no problem in getting the coding, and I think EMA is quite accurate in codes. And although you can override it, I never really do, because I think it's very accurate. And in the case of someone ever did get audited, which of course we don't want to see, I think their coding has all the parameters that are necessary, so you wouldn't have to worry about it. So I think it works quite well.
Okay. And it looks like we have just one more here, and this is asking if you would recommend to your colleagues EMA if they were considering adopting it for their ENT practice.
And yeah, I mean, part of the reason I'm even willing to do this webinar or talk to people about EMA, because I really do think, in my experience with EMRs, it's the best one, and it's probably the best ENT EMR because it's just so intuitive. It was set up by an ENT specialist who really knew his stuff. So I highly recommend it to anyone, and that's why I have no problem talking about it, because I really do think it's true.
Well, great. Well, we really appreciate that. We appreciate your honesty, and we appreciate your time tonight. And this is going to conclude tonight's webcast. If there are any questions that follow, you can send any questions to info@modmed.com, and we will be sure to follow up with you. And we just thank you so much, Dr. Brown, for your time tonight. It's been a pleasure.
Well, thanks for having me, and I hope that was helpful.
It was wonderful. Thank you so much, and have a great night.
Thank you very much. Okay.
Talk to you soon. Take care. Bye-bye.